Okay. Okay, so thank you all for attending. This is now being recorded. For those that, again, don't know my voice, this is Amanda Bruton, owner of Medicare Answers Now. And today we are going to talk about the COVID ending of Medicaid. For those of you that don't know, or over the last couple of years, because of the pandemic, anybody that was supposed to lose their eligibility for Medicaid was kept on Medicaid through COVID and the pandemic by the government, and now that is ending. So we have Jennifer Chumbley Hogue that is going to be the presenter. I'm going to go ahead and turn it over to her. You can put your questions in the chat, and then at the end, we'll go ahead and we will kick back and answer those. So Jenny, the floor is all yours.
Thanks, Amanda. Thanks everybody who showed up today. We really appreciate it. And for those of you who are listening to the recording later, we appreciate you as well. A little bit about me. I have been in this space owning an agency for more than 20 years. Before that, worked for a Big 5 carrier, and before that, a PBM. And my first job, I was a pharmacy tech at Eckert's. So this is all I've ever done. I have survived the initial Part D legislation in 2004. And then also ACA in 2014. And if there's one thing I've learned is that whenever there is major upheaval in DC, it is a great opportunity for agents to really shine and not only help their current clients, but gain new clients and become an expert in their field. The information I've got is accurate as of this morning, but there were things on Friday that changed. So do not take anything that I say as the gospel, because it's DC and the state. So probably it is going to change, but this will give you a basic overview about what's going to happen next. What's the public health emergency? This is the legal definition. In a nutshell, we had the public health emergency start in the spring of 2020. Part of that includes vaccines, medicine being approved for the public that's not FDA approved, but effective under what's called emergency use under the public health emergency statutes. It also includes Medicaid redeterminations were stopped beginning in April of 2020, which means anyone who's on Medicaid since April of 2020, whether it was due to income, maternity, foster care, Down syndrome birth, none of those people have gone through what's called a redetermination. They all have to go through the redetermination in the next 14 months. There is no manual process, no automated process for this. Everyone who is on Medicaid will be touched. There are 15 million Medicaid enrollees under the age of 65. These can be both due to what's called MAGI, Modified Adjusted Gross Income. And there's also a group that's classified as non-MAGI, and we'll talk a little bit more about that later. There's an additional 12 million seniors, or not necessarily seniors, but on both Medicare and Medicaid. The public health emergency's official date of expiration is May 11th, 2023. Medicaid enrollees, MAGI. These are based on income. It can also be for people who got it due to maternity if they did not have coverage and could not afford coverage. Then you legally have non-MAGI people. These are what I have always called diagnosis Medicaid, such as Down syndrome, spina bifida, things of that nature. But it also applies to foster care. Children who were in foster care or adopted from foster care are given Medicaid. If they turned 18 since April of 2020, they have kept their Medicaid, but they are also about to go through a redetermination. And this group is especially affected because they have never done a determination. It was given to them upon their entrance into foster care. Public health emergency. We're going to talk about the vaccines, testing, telehealth changes, what the carriers are doing, and also what agents can do. Vaccines. Federally purchased vaccines will continue to be free. It looks like this is going to be Moderna only, and Pfizer and Johnson & Johnson's vaccine, if that's still available, will be available via cost sharing. For group and individual policies, cost sharing applies. So if it's a copay at the doctor's office, it will apply. For Medicare recipients, due to the changes in recent legislation, all vaccines, including COVID vaccines, are covered at 100% as of January 1st this year. At-home tests. For group and individual health insurance, cost sharing applies. Same for original Medicare. Medicare Advantage, it may apply. It's going to be a plan-specific question. For Medicaid, those people will have them covered at 100% until 2024. So right now, you can order a lot of tests for free. They can, if you have clients who are interested in making sure they have a home test on at their house, go ahead and have them get them now before May 11th. PCR tests. These are the tests done in a doctor's office. For group and individual policies, it's going to be carrier and plan specific. So for clients, my response is going to be cost sharing applies. For original Medicare, cost share will apply. And for Medicare Advantage, it may apply. And you're going to hear this a lot. On original Medicare, it's going to be cost sharing. On Medicare Advantage, it's going to be plan specific. From a practical perspective, assuming your clients have a supplement, if they have Plan G, they're covered at 100% after the $226 Part B deductible. They have Plan N, they should assume they're paying the copay. Telehealth. Okay, I want everyone to stop on this one because it's important. Telehealth was expanded under the public health emergency. For Medicare and Medicare Advantage, it will continue to be covered through 2024. For Medicaid, it's going to continue to be covered through 2024. But if a Medicare or Medicare Advantage enrollee wants to use telehealth to get a controlled substance, such as Xanax, Lyrica, Vyvanse, whatever it is, that can no longer be done via telehealth as of May 11, 2023. So that's an especially important thing to get out to your clients as we move forward, because those will be the calls that start coming in June and July saying, why do I have to go to the doctor now? Even in a rural setting, controlled substance is going to require an office visit. Prescription coverage. So again, cost sharing will apply for original Medicare Part D and Medicare Advantage plans. It is going to be plan specific. No one has any clue what tier it will be. I've contacted 3 carriers and Medicare.gov. Nobody knows yet. But as you're probably aware, Paxlovid is not FDA approved. It was approved for use under the Public Health Emergency Use Act. There was something in the recent omnibus bill that passed. So even though Part D and MAPD cannot cover drugs that are not approved by the FDA, this one got a waiver. So Paxlovid will be allowed for Medicare recipients when the public health emergency ends. Medicaid will still be covering it at 100%. And just in case you forgot from the last slide, controlled substances, telehealth coverage ends at the day of termination. Carriers. So this has changed literally in the last 24 hours. As of today, Humana will do 3 months of what's called deemed eligibility for someone who loses their Medicaid coverage. They will let them stay on the dual plan for 3 months, assuming they think it's going to be corrected. All the other carriers, no deemed enrollment has been announced, nor are we expecting it. If a client is currently on a dual plan with both Medicaid and Medicaid Advantage plan, and they lose their Medicaid, they also lose their plan, they will be automatically enrolled into a Part D plan by the carrier. So I'm going to back up and make sure everybody's on that page. If your client is on a dual plan and loses Medicaid eligibility, they also lose their Medicare Advantage plan. The carriers are required to enroll them in a Part D plan. As of today, United Healthcare is going to contact clients, but it is state specific because each state got to decide which plans and which carriers can notify their consumers and clients on what is going on. So if you're sitting there shaking your head right now going, this is out of control, you're absolutely right. It is out of control. The rules. There is a 90-day special enrollment period for over 65 enrollees. If they lose their dual plan, they have a 90-day window to activate into a new plan. Whether it's they fix their Medicaid and need a dual plan, whether it's they can't get Medicaid back, so they go into a regular Medicare Advantage plan or guaranteed issue Medicare supplement, they do have automatic enrollment. The 10 and 30-day notice of termination, they're going to be given notice of termination 30 days out and 10 days out. They all, if they lose their eligibility into a dual plan, they will be automatically enrolled into a Part D plan. It will not have any of the Medicaid levels applied. They have to reapply for that. The notice of termination is very important. If your clients have not updated their local Health and Human Services department with any emails or their address changes, they're not going to get the notices from Health and Human Services. So that's another way we want to get in front of our clients. Is their information correct? Not just at the carrier and not at Medicare, but at the state. For under 65 and group clients, if they are currently on CHIPs, whether it's through the marketplace or whether they did it separately via their employer enrollment being too high, in theory, they should not go through redetermination because those redeterminations did not stop due to the public health emergency. If you've been doing this a long time, you probably already know this. What the government thinks is going to happen and what really happens is usually two different things. I highly recommend if you have clients on CHIPs that you will reach out to them just as you would a Medicaid client and make sure their information is up to date at not only the carriers and not only at the federal level, but at the state level to do their redetermination. If an individual loses coverage due to the public health emergency and their Medicaid ending, there is a 14-month window. That's not a typo, it's really 14 months to get a special enrollment period on the marketplace. For those of you who do ACA, if you're in a state that has expanded Medicaid, you probably have quite a few clients who are going to be on the bubble, whether they're on Medicaid right now and they lose their Medicaid coverage or whether or not they're on CHIPs. So definitely think about reaching out to all of your clients who are under 65, who either are on Medicaid themselves, their kids are on CHIPs, or if you feel like they're on the bubble, just make sure that they're aware of what's going on and their information is updated at the state. There is a 60-day enrollment window for groups. So if you have groups and you have a client who has an employee whose child was on CHIPs and they lose their CHIPs or they lost their Medicaid coverage, they have a 60-day window from the date of termination or date of notice, whichever is later, to enroll into the group plan. So the 31-day rule is out the window for this. They are getting a 60-day notice. If any of the groups push back or you have any questions, that's federal and it is available at the Department of Labor website. Over 65. Let's talk about what we can do to help our clients. Each state, and I'm going to give you the link at the end, has a redetermination timeline of who is going to be contacted and when they're going to be contacted. I'm in Texas, so I've really only based my education here on Texas. Texas is starting with people who are maternity Medicaid. So they didn't have coverage when they got pregnant. They went on Medicaid due to maternity, and they're not eligible any longer, most likely. And they're foster kids. That is the first group of people who are going to be receiving notices saying, we need to determine if you are still eligible. In these two groups especially, they have never done a determination to begin with. You'll have clients who have been on Medicaid for 20 years and know that on a regular basis, they have to go through a process to determine they are still Medicaid eligible. The groups in Texas that are going first have never done a redetermination. We are expecting massive fallout from this group especially. So again, Anytime you can get in front of somebody who you know is on Medicaid now, or perhaps you know a group that has foster care, get the word out and have them call you if they have questions. On your current clients who are dual eligible, you're going to want to get in front of them prior to April 1st, but you can't do it by then, as soon as possible. Do they have their information updated at the state level? Do they know, have they moved? Have they updated the website? You can talk to them about updating the website and walk them through it. Because just because the carrier has their information with their new address doesn't mean that information has gone to the state. They may have told Medicare they moved. Again, the state does not have that information. There's no communication on the addresses. So I have very few dual clients. I kind of dug into this because I'm fascinated when anything happens. And the ones I have, 2 of them live in one specific place. I'm visiting them not next week, because I'll be at Medicare and Margaritas. Thank you, Amanda. But the week after, and I'm taking them, just going down there, making sure their information is updated. And I am sure there will be a lot of people around going, what is going on? Because this location is a low-income housing unit, and several of the people there will be on Medicaid. I am more than happy to help out every single person who sits down with me and update their Your Texas Benefits address. Eventually, hopefully they'll become clients, but if not, I'm really good with the fact I helped out a lot of people who in Texas, if they're single, make less than $1,100 a month and have less than $7,000 in savings. That's what we need to do. That's what we need to do. But for your current clients, you need to get in front of them and get in front of them now. The last thing any of us want is for the clients to get a letter and then call you and say, you didn't tell me this. At least send them an email. All the state health and human services departments, there's a couple issues. Number one, their staffing woes are the same as everybody else's. They are severely understaffed, and this is a massive undertaking. Some of the states are looking to get this done in 2023. So instead of using their 14-month window that they've been given, they're trying to get it done in the next 8 months. It's not going to be pretty. The other thing I highly recommend you do is actually check your client database at least once a month. Has anyone fallen off? Does anyone show a termination date that's not 12/31 of 23? That's a great way to get in front of it. I know there's lots of chats. I'm going to keep going and go to the end though, just so you know. Under over 65 part 2. Again, a massive change. This is going to be for your original Medicare people. But during the public health emergency, the under observation rules where you had to have 96 hours before you could go to a skilled nursing facility, those were waived. They come back on May 11th, 2023. So make sure your clients are aware. And also right now, all Part D and MAPD plans were required to give a 90-day supply of prescriptions at retail pharmacy. Again, that will end on May 11th. Agent responsibilities. Most everyone on here right now is an agent. I think educating your client is one of our responsibilities. And I cannot stress enough that the easiest way to do this is get in front of it now, followed up by the 15th and last day of the month, audit your book. Who's active, who's not. But if you can make sure that their information is updated at Health and Human Services and that they're on the lookout for letters and also any emails, it will hopefully resolve this. Because not only are they going to lose their dual plan, they're also all of a sudden being paying for Part B. So if you have a client who has full Medicaid, not only do they lose their dual plan, their Social Security check is going to be $165 short the next month. That's a lot of money to these people. So anything you can do to get in front of it, the better. State guidelines. We're going to put this link in the chat later. Each state has a plan and each state has different outreach rules. So once again, you've got DC telling us what to do, with the states trying to figure it out, and everybody has a different idea of what to do next. So if you are multi-state located, you definitely want to see what each state is doing. The spreadsheet that we'll put in the chat also is from Georgetown Health, and it is updated pretty regularly on what the states are doing, including the outreach, what the envelopes are going to look like, and who's going first. So let's shine. Reach out to your current clients. Figure out what they're doing and how they can keep their Part B premium and their Social Security checks. Figure out how to keep them on their dual eligible plan. So as an agent, you're not dealing with not only chargebacks, but a lot of re-enrollments. But it's also an opportunity to shine and outreach. Working with your local food banks, working within low-income housing units. Anything you can do to get the word out to the people who might be eligible for Medicaid, whether they are or not, making sure that their information is up to date will definitely, you will reap the benefits later. This is just an example of what the Texas flyer looks like. It will be in the link later from Georgetown. Everybody can do, I've chosen to print these off identically and I'm passing them out at the food banks. But you can certainly take the information, make your own flyer, and ask people to start putting it up at food banks, local areas where you feel like there's a need. If Tracy wants to jump in, because she's very good in this area, but it gives you an idea of what it looks like. My shameless information steals. Most all of this came from the Kaiser Family Foundation. The redetermination rules were translated for me by Stacy Pogue at Every Texan. The link is to the rules for each state. And I also included a link to KFF with some basic information. I feel like I kind of flew through this, so I'm going to get to the chats now. And if you want to turn this, I'm not sure how the rules work. If they want to turn their microphone off, we can certainly go to it. So I'm scrolling up. Lorena said, looking forward to this. Thank you. Hi, Ami. Tracy, it is being recorded. Magi, thanks, Amanda. Modified adjusted gross income. So there are some things that apply to the modified adjusted gross income and some things that don't. You cannot use AGI from the tax return. So if you have any questions on that, just let me know. Is choices with Medicare sometimes a diagnosis-based Medicaid? I have absolutely no idea.
Well, this one I went ahead and I pulled the link because this is Tennessee specific. So for Angie's question, I pulled a link that was out on Tennessee regarding choices and Medicaid and the eligibility. There's 3 groups there, so see that link.
Thank you. Tracy Davis wants to know if the carriers are notifying us agents. I don't think so. Apparently Humana is the only one that does a decent job in this area now. So my expectation is that no, we will not be notified by the carriers and we're going to have to do it ourselves. United Healthcare's email did specifically state that we will remain the agent of record, which will probably work half the time and we're going to have to deal with it later. But no, do not depend on the carriers. They are not notifying us. Lisa, can we contact our clients and be proactive? Absolutely. Absolutely jump on it now. There's nothing wrong with calling your clients and saying, this is happening. Please make sure your information is correct at the Health and Human Services website. Here it is. Look in, you'll see it in the Georgetown thing. In Texas, the envelopes are yellow. You can tell them, look for these envelopes and go with that. Lisa said, thank you. The recording is available, but I don't know where Amanda puts them.
It'll be posted on social media. I'll put it on Facebook, and then I'll also put it on my YouTube channel, as well as we'll go ahead and we'll put it on my website, MedicareAnswersNow.com.
Thank you. Okay, Lisa wants to know the rule for 90-day supply of medication. Okay, so right now, whether it's MAPD or Part D, if a client wanted a 90-day supply of their medication, preferred pharmacy, non-preferred pharmacy, whatever, they could get a 90-day supply, assuming the doctor gave it to them on their prescription. Prior to April 2020, you could own, Every plan had their own rules. As a general rule, the answer was if it was a preferred pharmacy, you could get a 90-day supply, or you could get a 90-day supply via mail order. I don't think this is going to cause a huge disruption, but you probably are going to get some calls. Why could I get 90 days in April and now I can't in June? Well, because the law changed. So just a heads up on that. Jennifer Kaufman is my favorite today because she said this is the best thing she's attended in a long time. Tracy said, thank you. You're welcome. Patricia, if they are auto-enrolled into a PDP, can we use an SEP to move them? Well, if they're auto-enrolled into a PDP, you're already going to have an SEP due to loss of coverage. So assuming you're talking about MAPD, the answer is yes, because you're going to be within the time frame. So Melissa,
And I'll go one further. If somebody loses their eligibility on extra help, well, on Medicaid, that loss of Medicaid is going to trigger an SEP. So they'll have that as the option, and they have 60 days from the loss, the notified loss in the letter that they get, to be able to enroll into a different PDP or a different MAPD plan, depending on what it is that they're looking for.
for this specific one, Amanda, they're saying 90 days.
Good to know.
I don't know why they decided to make it different, because I think at this point they just want people confused. Melissa, does it apply to full Medicaid or partial as well? It's going to depend. If it's extra help, which is federal, the answer is no. If it's partial and it's run by the state, the answer is yes. So it's going to be completely dependent on, does the state HHS make the determination or is it federal? So in general, I'm going to tell everyone yes. From a client perspective, you need to get in front of all of them, because no one's going to have a problem if you tell them they need to do this and it turns out they were okay. Valda, you're welcome. The time frame on SEP is, for this, they're saying 90 days. We'll see. You're welcome, Eric. Okay. Sorry, I'm scrolling. Back to the beginning, you stated when members lose their dual eligibility, they would be auto-enrolled in a PDP. That is correct. They will have a PDP and original Medicare. Okay, this went really quick. Everybody's welcome. Thank you for all the thank yous. Does anybody have any other questions? Is everybody getting excited and they're going to go make a flyer and figure out where to pass them out? Valda, look at the KFF post, the link on the last slide. I believe it's there, and if it's not, I'll look later. But yes, it's there. Melissa, on the flyers, the example I sent you is definitely just what Texas is using. I personally see no problem with you putting your logo everywhere saying, got Medicaid, get some help. We've not seen any rulings on that. And Jamie, we've all been there. And most people's heads are spinning, including mine. And Jen, be safe. Anybody else have a question? Thank you, Amanda, so much for letting me do this today. I really appreciate it.
Thank you for presenting. It's awesome information. We appreciate it. Everybody, thank you for going ahead and taking some time to learn. And as mentioned, I will go ahead and get this out on social media probably in the next couple of hours. Have a great afternoon, everybody. Stay safe. And for those of you coming to Medicare Margaritas, I will see you next week. Have a great one, guys.